YouTube live. So Diwali is just going to get over in the next day. It's Panchami, and we have all celebrated Diwali and with crackers and a lot of joy. Now there are things which the most important things, when it's a lot of crackers and all. A lot of people suffer from cough because of the fumes, cough because of the fog, cough because of the crackers and the atmosphere, the pollution and all. And so you will get a lot of cases of cough in these days, and you will find that these cases sometimes don't respond to our treatment, and the case taking has to be very precise, so that you can get the acquired result. If you look at the repertory or the mater medica, there are symptoms where we can say that dry cough because of pollution, dry cough because of some allergen and all. So not considering only the smoke because of Diwali, but any kind of smoke. Whenever the patient comes to you for cough, remember this, please understand this. When the patient comes to you for any kind of smoke, and because of that the cough aggravates, it could be हम बोलते हैं ना कि if we are cooking food, छौका मारे हैं and the smoke starts, pressure cooker, the pressure cooker, the smoke starts, the pollution, the smoke starts, uh, the smog because of some burning charcoal, burning of paper, anything where the smoke starts. Good afternoon, Dr. Vishaka. The smoke is important. So whenever there is smoke, in general, as I am talking, then there are few remedies which have given me very, very good results. And out of that, the one remedy which I have found very much useful in that case, the first I would say it is beryllium metallicum. Yes, beryllium. It's a mineral, it's a carbon series, and as we know, smoke can liberate most of the carbon. So beryllium metallicum is a remedy which I have used, and that has given me very good results. It's a mineral, a series 2 carbon series. I'll come to the symptoms of beryllium later, but let me first finish the thought. The second remedy which I have found again, which is again infrequently used, but again that has given me very good results, that is limestone. Now again, limestone, we say cutting stones and then you get smoke is there. When you go to a place where the building material has been used, or we go to the crusher where the stones are crushed and the fumes come, the smoke comes. Limestone again is a very, very important remedy that I have found useful in my practice. Again, I will go further in detail about this symptoms lately. Third remedy, which is commonly used in a practice, day-to-day practice, that is Moxol. And fourth, I would say you can think about Staph aureus. So these are the 4 or 5 remedies that come to my mind whenever smoke comes. First is beryllium metallicum. Now, see, whenever you want to prescribe beryllium metallicum, it is very important to know that in relation to cough, in relation to what you call symptom, in relation to the particular part, there are other things also which are very, very important. The first thing, that is the workers, those exposed to the stages of preparation, inhale these fine powders, and then they get different type of symptom related to beryllium. Of course, stone cutters, glass cutters, fabrication of electric bulbs, or that these also exposure, if you get symptoms, that is beryllium. Now the general the chronic name for this is berylliosis, BERYLLOSIS. So these are basically the symptom which you take for prescription, the cause you take for prescription. Second thing, for beryllium, one thing which I have found in my practice is that the lips are dry and cracked. Because whenever we find lips are dry, lips are cracked, we have lots of remedies, nitramur and arsenic are there, but beryllium also has this symptom where the lips are dry and cracked. Now, symptoms in relation to the lungs, the pleura, is that there is painful respiration aggravated by movement. In lot of cases, you might think about bryonia. I also have given bryonia. When it failed, then I started reading why it failed. I came to beryllium.
This is how what you call, grow in your practice, that whenever failures come, don't get depressed. It are the stepping stones to success. Those are opportunities. The important symptom of local symptom of beryllium is painful respiration aggravated by movement. This is a very, very important symptom of beryllium. Second symptom that I found in the practice is there is cough is dry, cough is painful, aggravated by bending backwards. Whenever the patient goes backwards, that is aggravated, or aggravated by smoke. Of course, smoke is a very common symptom in beryllium, and ameliorated in a hot room. I am not talking about warm room, I am talking about hot room. I had a very interesting case of severe bronchitis of a very reputed doctor. I had also tried a lot of medicines. He had taken a lot of medicines from different doctors, no change. One symptom, after so many months, he told that my patients tell me, sir, how can you sit in this hot room without the AC? Though I have the AC in the room, but when I sit in this hot room, my cough is better. And that led me to prescribe beryllium metallicum, which I can never forget. So please write down this mater medica in your book, that beryllium metallicum, the cough is dry, the cough is painful, aggravated by smoke or bending backward, but ameliorated in a hot room. This is a very, very important symptom of beryllium. Yeah, hello, Dr. Ganesh Sahani, Dr. Disha. I was just telling about beryllium. Let us go forward. These are the symptoms which I have found in my practice, beryllium. That is the cough and this. One more symptom is that sometimes the cough has streaks of blood in it, and the patient has tachypnea and cyanosis to tell the tertiary symptoms of beryllium. So these are the basic symptoms of beryllium which I have used in my practice. Just in regarding to modality, I'll just tell I had a case of coryza, where the coryza was better in open air and aggravated in a warm room. Just opposite to the lung symptom what I told you about beryllium. So my dear doctors, keep reading this. Whenever you read mater medica, automatically you get lot of symptoms which you can never get in your normal reading. So whenever you have failures, make sure that you read mater medica, and you must get upgraded in your own practice, upgraded in your own knowledge of mater medica. Second drug, of course, lot of students have asked me to tell something about limestone. Now, see, limestone do not only have the symptom in relation to lung symptom, but there are other symptoms also which are very, very important of limestone. Hello, are you with me, everyone? I am taking a long time to discuss beryllium because this is a very important remedy which I have found very useful in my practice. And in this Diwali time, a lot of patients come and beryllium works very wonderfully. Hello, are you with me? Yes. Just keep chatting so that I know that people are there, because a lot of people are seen online, but then nothing is there on the laptop, which I feel I'm only talking to myself sometimes. So this was beryllium, which I have got very fantastic results in my practice. Now limestone. As I told you, limestone is not always related to the lung symptom. One symptom of limestone is that the patient of limestone, most of the time which I have seen, the delusion that he is waiting. Doctor, I feel that I'm always waiting for something. I'm waiting for my turn, I'm waiting for you to meet, I'm waiting for some good news, I'm waiting for this, I'm waiting for that. Life does not give me anything very easily. I have to wait and keep waiting. This is a very, very common symptom which I have seen in my practice in case of limestone, my dear friend. When I saw the rubric and the repeated delusion, waiting he is. Of course, there are other delusions also you can always go through. But this is a symptom which I have found so many useful in my practice. Now, one more symptom of limestone which has come across in my practice is memory is very active of past events. Memory which is very active for past events, and weeping just because of thoughts of others' grief at his own death.
he feels that way. But this symptom, of course, I have sometimes got, sometimes not got. But every time, what I've got is delusion, waiting is, and delusion, trapped is. Two symptoms which are very, very important, which I found in limestone: delusion, waiting is, and delusion, trapped is. The other two remedies which I have told you is, third is Merksol, and fourth is Staphylococcus. Of course, there are a lot many of remedies, but this I have got in my practice, which I have seen in my practice. I hope this part is clear, everyone. Yeah, you can say, all polycrest remedy, Disha, have some symptom in common to some recently proved remedies or infrequently used remedies. So there are definitely some common symptoms in limestone and calcarea calm. Okay, yeah. So I was just telling one symptom also. In this smoke, there will be a lot of patients who will come and tell you, sir, I feel as if I am smooth. There is smoothing. ऐसा लगता है बिल्कुल मैं चोक समझ smoothed लग रहा है मुझे. Now this is again a very, very important symptom. ऐसी लगता है, I feel as if there is lot of smoke and I cannot breathe. This is called as smoothed sensation. Smoothed, as if I have been close somewhere and there is no air to breathe. There is so smoothing sensation. And of course, there are a lot of remedies, but one remedy which I want to tell you today, which I have seen in these days, there are a lot of crackers, smoke. The patient feels smothered. SMOTHERED. I have found Millilotus. Millilotus is a very interesting remedy. Do study Millilotus. Do use this remedy in your practice for this smoothed sensation. It will give you fantastic results. You can read from any book, but in this you can of course go to the basic. We read Boric for most of the thing, but this is a very, very important symptom, smothered sensation. I'll just take one question because there are some, then I'll come again to, yeah. So my assistants are telling, sir, there is a question. Sir, kindly tell some medicines for lethargic feeling, both physical and mental, throughout the day. You can see simple remedies. Natrum carb, abrotenum, thuja, picric acid, argentum. Tuberculosis, dry cough की homeopathy remedy क्या है? See, whenever you have tuberculosis, whenever you have dry cough because of that, in homeopathy, okay, diagnosis is important, but just because it is tuberculosis, a remedy would change is not like that. Take this simple case as dry cough. We have a lot of remedies for dry cough. We have spongia, we have drosera, we have Coralia, we have Corallium also, we have Ipecac, a lot of remedies. And honestly, if you want dry cough, then you open your Mater Medica and you can get so many remedies for dry cough. You can get some common remedies like belladonna also, like bromium also, like hyoscyamus, bryonia, spongia, pulsatilla, lot of remedies. But whenever you are asking questions, the symptom has to be a little bit more defined so that I'll be able to answer this question. So dry cough, belladonna, bryonia. Okay, so I think this is done. Yeah, so my assistants are very anxious that whenever some questions come, you have to answer first the question. So I was just telling you something about Millilotus. Now in Millilotus, smothered sensation, I hope everybody knows that smothered sensation. This smothered sensation of Millilotus has given me good results when I also have failed in my routine prescriptions. Directly to give Millilotus was very, very difficult, but when I was reading Millilotus after failed remedies, one symptom of Millilotus which I have found useful in most of the cases I have seen. Two things is, first, tickling in the throat with cough. Not before or after, tickling in the throat with a cough. There is tickling with cough. And there is a lot of weight feeling on the chest. These two symptoms in Millilotus have given. See, imagine a condition you are passing in a road where there is a lot of crackers, a lot of smoke. You have inhaled some smoke, you go home, you feel a lot of weight on the chest because the cough is there on the on the chest, there is smothered sensation, and you get cough with tickling, because that smoke is irritating your larynx. This is a symptom of mealy-lotus, tickling in the throat with cough. So these are very, very important remedies which I have found useful in my practice. I hope you also use this in your practice. Of course, I am not telling that every remedy, every patient would have these symptoms and you will get these symptoms, but these are some rare prescription which I have used now commonly in my practice and I have got good results. So let us go forward. Yes, no questions? Means everybody is understanding what I want to tell you, everyone? Just tell yes or no or hi so that I know. So let us go forward. Smothered feeling is okay, and this is now there are some cough. There are some cough which basically require more attention. The patient says because of a lot of smoke and lot of air pollution, they have to strain. Have to strain too much to speak. Straining cough. You have Cuprum metallicum and Chilodonium that has given me very, very good results. Of course, there's one question, sir, what is suffocative cough? Suffocative cough you can get with or without pollution also. Varicocele 2 grade cured by, yeah, you can cure varicocele grade 2. I have a lot of cases and I have been very successful in treating varicocele. Now somebody is asking me suffocative cough. A suffocative cough you can get in asthma, in bronchitis, in chronic cough also you can get suffocative cough. There is a beautiful symptom in a remedy which we were taught in a college days. Suffocative cough, the child becomes stiff, wakes up blue, and the remedy is Sambucus nigra. There will be very few cases in your practice which comes to you with the same symptom, that the child becomes blue, because nowadays inhalers and cough syrups are available so easily that the patient always comes to you after taking the syrups and all. So suffocative cough, there are a lot of remedies. You can think about Sambucus, you can think about Ipecac, you can think about Hippursulf or Hyoscyamus, a lot of remedies. Yeah, so Ipecac also, if you see Ipecac Matermedica, if you just open your Matermedica and see Ipecac is a very, very important remedy, and Ipecac has this classical symptom again of this type of cough. Now there are a lot of symptoms of Ipecac cough, but I'll just discuss one or two symptoms of Ipecac which you will get in your practice. I'll just take a, sir, bronchi cough aggravated by slight cold exposure. Simple, you can think about Hippursulf, think about arsenic, think about Cystascan. Okay, so Ipecac. Previously the patient used to come to us, sir, every year, in this time, Diwali time I have cough. Every year during winter I have cough once. So the patient comes, you give treatment, he is better, then he stops coming. Again the next year patient comes, and we sometimes take the modality aggravation winter, every winter aggravation, this time. But my dear friends, remember one thing, yearly attacks of difficulty or shortness of breathing, Ipecac is a very, very important remedy. Every year, of course, the patient, when he comes first time to you, he might not able to appreciate that every year he has that cough. But when he comes to you quite frequently and you ask, and the patient says, Doctor Sahab, every year I have cough in this period only. So don't go with the modality yearly attacks of difficult and short breathing, and that is Ipecac. First. Second symptom. This is again a very important symptom. The chest feels full of mucus but does not yield on coughing. Whenever a patient comes to you, there is a lot of cough and rattling sound sitting outside our chamber in the waiting room. We say, Antium tart and Coccus cacti. We normally don't think about Ipecac, my dear friends. But Ipecac also, just because the word rattling is not written very precisely, it is written chest feels full of phlegm but does not yield on coughing. So just take the stethoscope and see the chest, and you have bubbling rails. So bubbling rails, chest full of phlegm, remedy is Ipecac. So when you find that Antium tart, Coccus cacti are not responding to your medicine, immediately think about Ipecac. Of course, a lot of other symptoms of Ipecac which are very, very important, but these two symptoms I have found very useful in my practice. And
Ipecac also has one symptom of continuous sneezing, coryza and wheezing in the chest. The patient comes to us, lot of coryza, what sardi hogi, lot of coryza, I just went outside and because a lot of smoke there was coryza and there's a lot of sneezing and there's a lot of wheezing in the chest. Don't always think about Rustox or LMC, of course they're indicated, but think about Ipecac also. Okay, are you with me? Hello, are you with me? Yes, nobody is answering. I hope you're understanding that. Okay, so this is Ipecac. This was the cough which I wanted to discuss today. That was because a lot of patients, doctors commented, sir, which remedy normally we give, in this type of cough. You can always think a lot of remedies which are basic, very common. You can think arsenic, you can think kali carb, you can think bryonia, you can think about phosphorus, you can think about a lot of remedies, carbo-wedge, natrimur, but these are the infrequently indicated medicines which you must think when you are prescribing for this type of coughs, suffocative coughs, smothered feeling, because of tickling and all. These are the cough which are very, very important. One more symptom which is very, very important in this type of cough, or you can say question, sorry. So my assistants are always with me. This is a question is there. Okay, so 23 years old girl PCOD patient has periods in every 2 months, and meanwhile she has bleeding for 20 days without stop bleeding in the bright red and scanty drops. Dr. Ram Prasad, see, PCOD, polycystic ovarian syndrome or polycystic ovarian disease, it is basically the cyst in the ovary. If you read the books of medicine, it is basically a syndrome. It has a lot of other symptoms apart from the cyst, apart from the menstrual problem. You can have hirsutism. The point is you have to prescribe or take the whole case and give a constitutional prescription. There are no shortcuts in prescribing for uterine ovarian cyst. Like people say for cyst, calcium is very important, silicia is very important. It does not work like that, my dear friend. Take the whole case because it's a syndrome. The whole constitution is at stake. So in this, constitutional prescribing is important because maybe because of the cyst there is menses problem, because of the cyst the menses XYZ. So if you prescribe only for menses, the remedy works, and the next month the menses are okay, other symptoms starts. So if you prescribe only on a particular part, then you will not be able to cure PCOD. Of course, you can give relief with acute remedy of the menstrual flow, but the cause would be the constitutional medicine will definitely give you the desired results. Lot of remedy which I have seen in my practice, like sepia, like calcarea floor, like pulsatilla, phosphorus, kali carb, lots of medicine. But just let me add one or two things in this case. If you think your remedy is right and it is not giving results, in this type of cases, I have seen folliculinum works very well. Folliculinum as an intercurrent works very well. Or you find that the patient is not menstruating only for months, maybe going for an ovarian failure, then in this case, Uferinum, OOPHRINUM works very well. So for follicle problem, you can think about folliculinum, and for ovarian failure where there is no menses because there is no formation of ovum, so you can think about Uferinum with the indicated constitutional medicine. I hope I am clear, Dr. Ramdas. Okay. Yes. So let us go forward about the cough. If you don't understand, just write so that I can always give you other explanations. But if you understand, just write that you've understood so that I can go forward. So sometimes the patient comes and tells us that, sir, in this type of weather, see, I've come from the smoke and I have so much cough. I feel exhausted. I cannot breathe. I have to just go and lie down. Weakness and back. I'll just take this question first, and then I'll go with the my thought about the cough and all. So this is a question where the patient says, don't ask questions on WhatsApp, so it becomes difficult. So this is a question where the doctor has asked me, there is a lot of backache
backache, especially after seminal discharge, or after quite or this type of complaints. Now, see, if the patient is suffering from backache, okay, because of seminal discharge, there are 3 or 4 remedies which I have found very useful. Of course, there may be other things also. First of all, if you are precisely working only because of that, you can take a generalized symptom elements from loss of vital fluid. Simple, you can give China, you can give other remedies, phosphoric acid also, you can get the result. There are remedies where the patient says with the aggravation from seminal emission, a lot of backache and other problems, you can think about selenium, staphysagarina, phosphoric acid, nux vomica, and calicarum. These are very, very important remedies you must think about. Okay, so I hope this is okay. Now I was just dealing about, I hope this is okay. If you feel okay, then please write so that I can go on what I want to tell you something about the cough part. Okay, sir, skin में dryness है, unwanted hair are coming, PCOS. Yeah, that's what I'm telling you. These are the symptoms of PCOS: unwanted hair, hirsutism, I told you, hemorrhagic cyst, menses problem, ovarian pain. So this is basically a constitutional prescribing. This should be a constitutional prescribing. Take the whole case and then you can get a lot of good results. So I was just telling you something about cough. The patient goes from this pollution, from the smoke, goes home, coughs. He's so tired of coughing, just goes and sleep, cannot do anything, cannot celebrate the festival also. So we have a very interesting symptom, exhaustive cough. We have exhaustive cough, and in exhaustive cough, whenever we tell, the first remedy comes is sternum metallicum. It is definitely there where there is weakness of the chest, especially of the left side, there is emptiness filling in the chest. Of course, it is there. But there are other remedies also which are very useful in this type of cough. Exhaustive cough, the patient gets tired because of cough. Sternum metallicum is there, but I have found very good results with 3 remedies which I am going to share with you. First is sternum metallicum. Second is carboveg, my dear friends. Carboveg. If you have not prescribed carboveg for cough, exhaustive cough in these pollution days and lot of smog and all, carboveg is a fantastic remedy. They inhale lot of smoke, lot of carbon, again carbon, go home exhausted, cough and go to sleep, cannot do anything. Carboveg is the fantastic remedy. Third, you can think about coccus cacti. Can you tell us anything about hair transmission treatment? No, I don't prescribe on hair transmission method, so I'll not be able to tell you something about that. Sorry for that. So I was just telling you something about exhaustive cough. Sternum metallicum is there. I was telling carboveg. The third remedy is coccus cacti. Again, a very, very important remedy. Please go and read coccus cacti from Boric Mater Medica. Of course, I use, that's why I'm telling you. Other remedies you must think about is cocculus indicus. Cocculus indicus have the same symptom of weakness. And of course, don't miss out on arsenic album. Malignant weakness. Extreme weakness because of cough. The patient coughs and just goes to sleep. Exhaustive cough. So these are few 4-5 remedies which I have used in my practice. There are lots and lots of remedies, my dear friend. But these I am just sharing you my basic knowledge of what I have been doing in the past 30 years in my practice in this type of seasons where there is a lot of pollution in the air. Okay. Today there were very few questions. Maybe I am speaking too much and I don't give chance for the other to speak. This is the common, complaint about my students also, but because when I start speaking, I don't stop. And when I start speaking mathematics or repetitive, I keep on speaking. So if you have a problem, you can always write, sir, you stop, we have a question. Because if you don't ask questions, then, we do not grow together. So if you have any questions, you can always pin and I will answer it as soon as possible. So I was just going to tell you bronchial cough, any cough that comes from the bronchus, from the lung is bronchial cough. So again, some precise questions, some precise modality, and I'll be able to answer you better, So that this is what I want to tell you. Whenever you're taking a case, have at least 1 or 2 modalities, have at least one modality and one defining feature of that cough with pain in the chest, holds the chest while coughing, cough with urination, cough with perspiration, cough with watering of the eyes, cough with pain in the throat, cough from tickling in the larynx, exhaustive cough, minute gun cough, lot of coughs, so make sure that you basically have these type of cough symptoms in you. So it is already half an hour. Sorry, some questions are unanswered, but I'll answer in the next YouTube. I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.